Hi, back to chapters 1 through 3. We're going to focus on evidence-based practice, PICO questions, and meta-analysis, okay? In chapter 1, we did discuss intro to nursing research in an evidence-based practice environment. Chapter 2, we just got more into evidence-based nursing practice and, how it applies to research. And now in chapter 3, we're just going to really focus on qualitative and quantitative research and how it applies with evidence-based practice towards your own research. So just as a review, I just wanted to refocus on evidence-based practice because it's so important. Remember the 3 components of evidence-based practice: focus on clinical expertise, patients' preferences and values, and of course, best evidence. This hierarchy we talked about in class a little bit, the last class, and this hierarchy is something you're going to use to really evaluate your literature review. So remember, the bottom is the least amount of research-based evidence that they have within the study, going all the way up to level 1, which really does meta-analysis, systematic reviews, and as we go down, you can see which sort of evidence they have for each level of your studies that you're looking at. In the next one, it actually gives you a little more information in terms of where to find this research-based evidence. So I put an arrow here just to remind you guys that as you look at your studies and when you're doing your literature review, if, as you go up this tower, I guess you could call it, just remember that, the higher you go, the more research-based it is, the more actual evidence-based practice you have to validate the research. And one of the interesting things I like about this particular slide is that we have the different sources of where this information is coming from. So when we start to get in cohort studies, controlled trials, this is when you get into those sites where you're actually going to be looking for your literature review articles, up to date, PubMed, CINAHL. And this today in class, we're going to go over, Professor Alana is going to go over how we can actually log into the library database at Mount St. Vincent, and you have access to these sites so that you could get access to the articles. Because keep in mind, you have access to the sites outside of the library of Mount St. Vincent, but we actually have accounts with them, so you can actually have full access to the articles themselves. If you didn't, you have to pay for them. So these are the databases that we'll be looking at. And remember, when you're looking for your literature review and you're looking up different articles, make sure you filter and put in that you don't want it any more than 5 to 7 years old in terms of studies. We don't want studies to be too old, then the up-to-date information is not so accurate because things change. Okay, the next big thing we really want to get into that I hope you read about in your text is understanding paradigms. The biggest thing is when you're reading these articles, we're, as human beings, we all have our own views on things. And one of the things you have to understand, especially from a study standpoint, is how people think, okay? So one of the things you want to consider when you're doing your own research is how you think and where you're coming from, your perspective on things are. So for instance, if you're talking about religion with somebody, you kind of want to know what their background is in terms of what religion they practice, because it kind of gives you an idea of where they're coming from in terms of their background, whether it's culturally or spiritually, any sort of background of that nature, because it does give them different viewpoints. So in terms of research and key paradigms to know for nursing research, there's the positive paradigm and the constructive paradigm. So the positive paradigm focuses on that reality exists and there's a real world driven by natural causes. And then the constructive paradigm is reality is multiple and subjective, constructed by individuals. Okay, and it's important to know this because this will definitely affect the type of study you're looking at. So when you're looking at a constructivism paradigm, you want to think qualitative, because constructive paradigm reality is not fixed. So they're more of subjective, sensorial type studies, okay? So things can change a lot in these types of studies. So knowledge and reality are human constructs and therefore are subjective. All right, so you're looking at people's experiences and how they react to them. That's more of a qualitative research and it's a constructivist's view. Then we have the positivist paradigm where reality is fixed and it's associated with quantitative research. And I always remember this by saying, okay, numbers don't lie because numbers are fixed. They are what they are. Like when you get on the scale in the morning, that's what your weight is. Like you can't make it up, right? So it's quantitative research. And remember, with quantitative research, another way to remember is quantitative has the word quantity in it. So again, we're looking at numbers, mathematics, experience and observations that are all mathematically proven, okay? It's more scientific, traditionalist, objective, and experimentalist because they're doing a lot of experiments based on numerical values, all right? Okay, quantitative, like I said, like quantity is measurable and qualitative is more observable. So qualitative, you use your senses to observe the results, and quantitative is more used with instruments, rulers, thermometers. All of these results are measurable. Here with product development, they give a great example of qualitative research. Again, it's with the senses, so you explore, go deep, seek to understand. Versus quantitative, you're quantifying things, you're validating, and then you're making decisions. So here are some examples of the types of questions, the different research is asking. So quantitative research versus qualitative research. So in qualitative research, we're looking at the dimensions or characteristics of the phenomenon and what is important about the phenomenon. And as opposed to quantitative, they're looking at how prevalent is the phenomenon and how often does the phenomenon occur, how intense is the phenomenon. Again, all these things are measurable here. What factors are related to the phenomenon? Okay, what are the antecedents of the phenomenon in quantitative? And then qualitative is, what is really going on here? How is this phenomenon experienced? How are people feeling about it? What is the process by which the phenomenon evolves? Okay, so again, quantitative, what is the underlying cause of the phenomenon? Does the theory explain the phenomenon? So quantitative can be very black and white at times versus qualitative kind of can go into more gray areas. So just keep that in the back of your head when you're looking at your research articles that you're reviewing. Again, I love these visuals because they kind of give you a kind of a visual idea of what exactly quantitative is versus qualitative. And, we can easily define the two types of research, but, this is a better way of just getting a generalized view on it, because the other thing you need to realize too is research sometimes can go into both. You can have a study that does both quantitative and qualitative type research. So they can intermingle. So it's important that when you're reading something, like what viewpoint it's coming from, so you know how to kind of focus your own studies. So again, quantitative with quantity, they're looking at deductive, objective, numbers, right? And then qualitative, subjective, not generalizable, words, like how they're feeling. And I like this one where it tells you about qualitative, talking about names is John, Patricia, Mary, smells, colors, again, the senses, what are they experiencing? That's the qualitative studies. And the quantitative, again, numerical values, the weight of a person or a subject, your shoe size. These are numerical values that are fixed. Okay, great. Now, let's look at some research examples of quantitative studies, all right? And this one came out of the Journal of Cardiovascular Nursing. And the study itself, again, this is a quantitative study. So let's think about words that would key you in on, okay, this is definitely a quantitative study. Now, keep in mind, the studies are not going to list out loud what it's focused on, like what type of research it is. You're going to just guess based on when you're reading it, or take an educated guess. So just by looking at the study methods, you can see right here that, in terms of the study, they're promoting heart health among rural African Americans, and the study methods they're using is very analytical in terms of numerical values. I mean, I don't even have to really read this. Just by looking at these numbers, I can see, obviously, they're looking at numbers, and that's how they're basing their key findings. So right there, again, quantitative is a quantity-based study. So right there, I already kind of have a grasp on this is a quantitative study. So basically, they took a total of 115 adults in an intervention group, and they 114 of the group were not receiving the intervention. Those in the intervention group received the weekly 90-minute cardiovascular health promotion intervention for 6 weeks, whereas those in the control group did not receive any health promotion education. Everyone who participated in the study completed questionnaires before the start and 6 weeks later, and the questionnaires were used to gather information about the participants' attitudes, intentions, and self-efficacy. So right here, you could say this is a little bit more quantitative, but at the end, in order to figure out their conclusion and their key findings, they definitely based it around the numerical values of their findings. Okay, so here's an example of a qualitative study. I can never be too comfortable. So that right there, that statement, just talking about somebody's comfort level, that would clue you in right away that this is about how somebody's feeling. And so obviously it would be more of a qualitative study. So they're looking at race, gender, and emotion at the hospital bedside. So the purpose of this descriptive study, again, one of those qualitative type words, was to explore how gender and race intersect to shape the emotional practice of nurses as they experience, manage, and reflect on their own emotions in the workplace. So they sampled 48 nurses who were diverse with respect to gender, both women and men, and all 3 different races, white, black, and Asian. And they were given a digital voice recorder and were instructed to make a recording after 6 consecutive shifts. And they were asked to reflect on how they felt, describe things that influenced their emotions, and explain how they responded to their own emotions. Again, we're talking about feelings, describing experiences. Like, this is all a qualitative type study, okay? And like, I love this little joke here because it's perfect. It says, what did you feel when you saw the free ice cream? And why was that? And he goes, excited, a little scared. Like, that's a definite qualitative little interview right there. Okay, next. So more examples of quantitative versus qualitative. Okay. So again, example of quantitative data. Thinking about the past week, how depressed would you say when you, on a scale of from 0 to 10, where 0 means not at all and 10 means the most possible. Again, quantitative. We're looking at numbers to make our research points. More quantitative. They looked at a total of 453 patients recruited from 14 elementary schools, were assigned at random to either receive intervention or serve as non-intervention control group. Saliva content was measured at the start of the study and then at the end of the intervention 2 years later. In the intervention group, average nicotine levels dropped from 239 to 99.3, whereas in the control group, average nicotine levels increased from 221 to 239. And they gave you a p-value. Now this p-value, again, right there, if you see a p-value, it's quantitative. Okay, we'll get more into the p-value and how that formula, but again, quantitative, quantity, numbers, that's your quantitative study. Versus qualitative, here we go as an example of qualitative. Question, tell me how you've been feeling lately. Have you felt sad or depressed at all? Have you been generally good in spirits? Been good in good spirits? And then the data is, very much based on, no, I've been depressed lately, to tell you the truth. I can't ever remember feeling better in my life, like different responses in terms of feelings. This is gathering qualitative data. Okay, now that we understand the differences, again, qualitative is information that can't be expressed as a number, and quantitative data is a data that can be expressed as a number. The data type of qualitative, again, words, objects, pictures, observations, and symbols. And then quantitative, we're looking at numbers and statistics. And don't forget your p-value, very important. But we'll get into that. Okay, so here's looking at the steps, the major steps in a quantitative study. Now, in a quantitative study, because it's so structured and you're looking at numbers, the study phases, or the steps to get to the study, tend to be very linear. And that's why I put this arrow here. Like, you pretty much go step 1, step 2, steps 3, step 4. And you start with your conceptual phase, meaning you come up with the concept. You think about what you're about to undertake, okay? Then you design and plan the phase. You select your research design, develop protocols, identify the population. You get like all the meat and potatoes of how this is gonna work, right? Then the empirical phase, you start collecting data and preparing the data for analysis. Then step 4, analytic phase, you actually analyze the data and interpret the results. And then of course, step 5, you disseminate. This is called the dissemination phase, where you communicate the findings and then you try to figure out how you're going to utilize these findings going forward in practice. But again, a quantitative study, very important. It's very linear. I mean, you basically phase 1, phase 2. There's no back and forth between things, reconsidering, going, circular. It's pretty consistently straight through. As opposed to a qualitative study, it can go back and forth between gathering data and then developing more data strategies. Because again, with people's feelings and emotions, things tend to change. So sometimes you gather data and something you realized that you didn't think about before, you may want to change your strategies and how you're going to collect your data and ask different questions in order to gather more data. So, that's why it's kind of more circular. So in the qualitative study, first we plan the study, then we develop data collection strategies, then we gather and analyze the data, and then we disseminate the findings, okay? Very similar steps, but they just kind of go in a different direction as opposed to quantitative. Now, one of the reason that this is so important is because when you're considering your own study and what you're going to research, you want to know what steps or what type of responses you're looking for in terms of your research is going to best fit you and what you're studying. So are you going to need more of a numerical values to prove your research, or is it more based on feelings and emotions and responses? So that's where you have to really think about how is it going to make the biggest difference with your research. And in class, we're going to kind of apply your research topic to both types of studies. We're going to see if we can kind of do this plan, this activity of figuring out a plan in both respects and see which one would work better for you. And it may not even just be about the research itself coming out better. It may just be in terms of you doing the research, you feel more comfortable with doing it one particular way than the other. Okay, so now that we know about how, we look at the research in terms of the paradigms, the views we have, the views other people have, how we're going to apply our research, whether it's quantitative with numbers or qualitative with feelings, now we have to actually develop our own research question. We've been talking about the PICO question quite a bit, so I just want to go over that again. This is just going to format your research question. It's a very simple acronym, PICOT, and this will help you create your research question. So P is for population, what specific patient population is of interest that you're dealing with. Your intervention, what intervention or policy is being studied. Sorry. Your comparison, what is the main alternative that you're going to consider? Your outcome, what should be measured, and your time frame. What is the appropriate time period to assess the outcomes? Okay, so again, this is just going to help you format. It's a very simple way. Just plug in the information. Population, who am I dealing with? The intervention, what are we going to do to help these people? How are we going to change things? The comparison, what could we do differently? The outcome, what are we expecting here? What are we measuring? And the time frame, when are we going to do this? How are we going to do it? In what time frame? A week time, 2 weeks, 6 weeks, a year? And again, it's all about baby steps getting to the bigger picture. So you may get overwhelmed. Just stick the information in, and you can always change it later as we start to develop this. Okay, so let's look at examples of a PICO question. So here's a PICO question. What is the duration? And in terms of PICO, let's just say it's not a PICO question. Let's just say it's a research question, and we're going to break it down into PICO acronyms. Okay, so this is the research question. What is the duration of recovery for patients who have gone through total hip replacement, who develop postoperative infection as opposed to those who did not during the first 6 weeks of recovery? Okay, so what is our population in this question? Patients who have gone through total hip replacement. And what is the intervention? They developed a postoperative infection, okay? The comparison is obviously as opposed to those who did not develop postoperative infection. And it's basically the opposite of what you're looking at. That's what you can look at from a comparison standpoint. The outcome, the duration of the recovery, okay? And the time we're looking at during the first 6 weeks of recovery. That's what we're measuring, all right? Let's do some more examples of PICO. So here we go. Our children, which is your patient population, raised by obese adoptive parents, which is your intervention, also at increased obesity risk, that's your outcome, compared with those, which is your, actually that should be C, sorry, who do not have obese adoptive parents. again, that's more comparison between the ages of 3 and 18. And T is your time, right? How do pregnant women who are recently diagnosed with diabetes view the need to report their blood sugar levels to their healthcare providers during their period of pregnancy and 6 weeks after giving birth? Okay, so in this question, pregnant women are your patient or problem or population who are recently diagnosed with diabetes is your intervention, or what needs intervention. You could look at it from that way too. View the need to report their blood sugar levels. That's your outcome, because that's what we're looking at is blood sugar levels, to their healthcare providers during their period of pregnancy and 6 weeks after giving birth. That's our time frame, right? We're looking at during their period of pregnancy and 6 weeks after giving birth. Okay. Among operating room nurses performing a 5-minute scrub, what are the differences in the types and presence of microbes found on natural polished nails, as well as nail beds compared to artificial nails during the time of surgery? Okay, so who's our patient problem or population? We're looking at operating room nurses performing 5-minute scrubs. And what's our outcome? What are the differences in types and presence of microbes found on natural polished nails as well as nail beds? Our intervention is compared to artificial nails. That's our comparison. I'm sorry, this was the intervention found on natural polished nails as well as nail beds. The comparison is compared to artificial nails, and the time frame is during the time of surgery. Okay, so you get it? The PICO is not the question itself. The research question is the question, but the research question has to fit into these particular things. We're missing time here, but time is part of it too. And sometimes you won't see in the research question the time. You know, it just depends on the research itself. But this is how you break down your question. This is how you formulate your question, okay? All right, so now we need to apply our research for your PICO question with the use of the meta-analysis grid. So first, obviously, you gather your articles. You're going to gather them from trusted sources. Remember to look at the title of your article. Right there, it's going to give you like a ton of information as to whether or not this article is even applicable to what your study is about, okay? So keep in mind, the articles are usually broken down pretty consistently the same way. The abstract. I love the abstract. The abstract is my favorite part of the article because it gives you pretty much everything you need to know in a little short blurb. Just like reading the back of a novel, like you want to know what the novel's about, you read the blurb. It's the same thing with the abstract within the research article. Skim through that quickly. The best part for me is always the background and the conclusion. You know, look at those two things first. That's going to tell you right away, does this even remotely look like it could have helped me at all with my study, okay? Then you're going to look at the introduction, which explains the study's problem and its context. Then you have the methods section, which is the strategies used to address the problem. Then you have the results section to use to study the findings. And then they have the discussion section, which is a long, lengthy interpretation of the findings, all right? But again, look at your title, look at your abstract. These are the two biggest things that are really gonna guide you as to whether this article is even worth your time at this point. Okay, now once you've gathered your articles, gather your data and enter it into the meta-analysis grid. Now, I'm sorry, this thing is really long, but you're going to be able to print this off of your syllabus or off the Canvas, and you're going to need to download it into your Microsoft Word because it's literally a table you're just going to enter information into. And I'm going to go through this quickly because this is really something you can kind of look at yourself because it's pretty basic. I mean, this is the article we're going to review in class today. So I use this as our example to go through with you. And I've broken down each box to show you how it goes in here. And now all of this has to fit in here, so make sure you make your text really small. On the Microsoft Word template, you have bigger boxes, but it does kind of go in. It'll take a few pages for sure. Now here is the link for this particular article. So if you wanted to download it, it is free. All right, but let's start our meta-analysis grid. I got this. I'm going to be doing research on pressure injuries. So I found this article. It looks great. It's recent. It's from 2019. Remember, super important. You don't want something older than 5 to 7 years. So that'll work for me. And it's about reducing hospital-acquired pressure injuries. So great. I'm going to use this article. I've already decided. I read my abstract. I think it'll apply. First box, name of the author, date, and publication and title. Okay, all right here. And it's interesting. They even give you a little cited box. So if you want to cite this article, you literally can copy and paste this. So here's your authors, your date of publication, and your title right there, right in the box. Box 1, done. Okay, next box, conceptual framework. All right, so this can get a little more tricky. I'm going to be honest with you, not all articles will tell you what conceptual framework they used, but in this particular one, within the abstract, they did tell you. They told you right in there that they used the Institute for Healthcare Improvement Model for Improvement, and that was their conceptual framework. I never even heard of it. I had to look it up. Just keep in mind, you know, we had done our discussion board question on, and we gave you a list of different frameworks. There's a ton of them out there. There's a ton of frameworks. You're never going to memorize all of them. You're going to have to look them up and just kind of use them as a guide when you're reading your articles, just so you know where, again, they're coming from. So in particular, this conceptual framework, I happen to notice that this is basically what it looks like. And it's the Institute for Health Improvement. And it's very basic. Aim, what are we trying to accomplish? Measures, how will we know that a change is an improvement? And changes, what change can we make that will result in improvement? Act, study, plan, do. I mean, that's, again, a very basic framework. It just kind of guides a study as to how to do things in the right steps so that you actually achieve outcomes, measurable outcomes. So there's our second box, conceptual framework, Institute for Healthcare Improvement, Model for Improvement. I'm going to plug that right in there. Next one, box 3. Okay, now we're looking at our design/method. Again, I just read through the article. They basically said the change strategy was based on implementing an evidence-based risk assessment tool and bundled. Now keep in mind, you want to kind of keep these descriptions of each one pretty slim. So don't go crazy. Just try to get a very basic idea. Okay, this is the design, this is the method that they used, because you have to fit a lot into those boxes. But again, you're looking at it, you're highlighting it in your article, and as you go through, you're going to see right away whether this is going to work for your study or not, or if it gives you enough evidence and actual data that would apply to your research. So that's their design method. It was called a change strategy. And they used a PIP intervention termed a PIP bundle. These are all new things to me too. I mean, this is something that they created to use for their particular study. So you kind of just have to decipher what exactly it is and put it in the box. Fourth box, the sample/setting. Again, this is a pretty easy one. Who are they studying? What is their sample? So that they're using the total number of patients that have hospital-acquired nosocomial category stage 2 or greater pressure injuries on the day of the prevalence study. So I didn't even have to write all this. I just did for you, to kind of give you, like, show you how I'm doing this. But really, I could just wrote total number of patients with nosocomial stage 2. I could have put that in the box. That would have been adequate. Stage 2 or greater, I should say. Okay, fifth box, major variables studied and definitions. So this gets a little more complicated, and you really have to look at how they're figuring things out. But in this particular one, they did a project team. They ran 3 different cycles of something called the Plan, Do, Study, Act. And again, that goes back to their framework, okay? And based on that, they aim to reduce the hospital-acquired pressure injuries, prevalence, and admitted patients with a key focus on evidence-based pressure injury risk assessment and prevention bundle. Those are the things they really looked at in order to make changes. Okay, number 6 box, measurements of major variables. So we're going to the next one. These were the measurements they really looked at, and it's listed very black and white within the study. This is what they're measuring. These are the 3 big things. It was very easy to decipher. I just went in and wrote it right in. I mean, and for most studies, they're pretty descriptive, as they should be. If you're finding it's really hard to find the information within the study, maybe it's not such a great study, because most studies really want to make sure that their points are getting across clearly. So they really make sure they're writing things very clearly. Okay, 7th box, data analysis. Okay, so this is a little more tricky because I was trying to condense it, but it is in there. It's, data collectors were trained and given standardized data collection tools, obviously, and then they were collected on a daily basis and analyzed on a weekly basis using control and run charts with an Excel spreadsheet. Now, definitely the data analysis gets more complicated than that, but that's keeping it pretty basic. You know, this was definitely a quantitative study, and that's really kind of what you want to focus on looking at in terms of your data analysis. You want to know, is it quantitative or qualitative, and how did they analyze the data? So with quantitative, obviously it's a numerical analysis, and quantitative or qualitative, it could be different. They might use surveys or responses and gathering those sort of, you know, any kind of emotional responses, questionnaires, interviews, feeling-based things. Okay, the eighth box is your study findings. So again, this is pretty easy. It's like either in the conclusion, you could find that in the abstract in the conclusion, but they just basically tell you what they found. What was there an improvement? Was there a change? Was there a reduction? And of course, because it's a quantitative study, quantity, it's giving you numbers and a p-value. And then last but not least, the ninth box, appraisal of the worth to practice, strength of evidence, and quality of the study. Now, the study, of course, usually they definitely most of the time try to find all the positives of their study. So you want to just kind of go through what they said about what they felt like actually, did they achieve their goal? Did their interventions show improvements? Were their results favorable, and can they apply this study to any other studies going forward? And that's really what you want to look at. And then for you, in your case, you definitely want to look at their results and see if what they applied would actually, apply to your study and help you, run your study for improved outcomes. So that's the end of this review. And what I think I'll do is definitely take the actual PICO slides and the meta-analysis slides out of this PowerPoint and separate them, just so you guys can really hone in on these particular subjects if you wanted to review these slides. But we'll go over this in class again, and we'll definitely help you practice doing the literature review while we're in class with group work. So this particular article that I did break down into the meta-analysis grid, we're going to actually be looking at it in class. And this is the one about reducing hospital-acquired pressure injuries. All right, thank you.